Hi, Dr. Willey. So today I will be asking you some questions because you are the winner of the Osborne Award 2025, which is given by the Radiation Research Society to member who has contributed significantly to understanding the normal tissue response to radiation. So this is really a privilege for me as a scholar in training to have the opportunity to ask you directly questions because your work is very inspiring. So I'm sure it will be of interest of the young career scientists and, of course, the community of radiation research. You are a Milton Rabin Professor of Radiation Oncology and the section head of radiation biology and director of radiation research at the Wake Forest University School of Medicine. Your research focuses on preventing radiation-induced bone damage and fracture, both in cancer patients undergoing treatment and in astronauts exposed during spaceflight. And you are a trained bioengineer at Clemson University. More about your work. Historically, bone was considered one of the most radiation-resistant organs, but your work changed that view. You were the first one to demonstrate that bone is actually radiation-sensitive, and you lead a highly collaborative lab that brings together resident biologists, engineers, and physicists to better understand and prevent normal tissue toxicity caused by radiation. So my first question is, from clinic to cosmos, your research spanned both protecting cancer patients from radiation-induced bone loss and helping astronauts stay strong in space. What sparked your interest in bone physiology on Earth and beyond?
Great question. First of all, I'd just like to say thank you so much. It's an honor for me to talk with you and talk to the SIT community and the whole radiation research community. It was an incredible honor to receive the Osborne Award. I also just want to say that our work with bone really has been a very exciting sort of path that involved us and other groups as well, in which we have a finding, another group has a finding, and we're building off each other. We've become friends in that context leading up to the work we've had here. So it's been a collaborative effort with many individuals across the country. So, for me, I went to graduate school specifically because I wanted to improve human health during space flight. I'm a bioengineer by trade. My undergraduate was focused on physical therapy, and then I did a master's in functional anatomy. So I was really interested in bone form and function. And I knew that in astronauts, they lost a lot of bone. So I went to go work with a man named Ted Bateman. And really, the focus at the time was microgravity effects on bone, because that's what was thought to, cause bone loss. If you don't use bone, you lose it. And as it turned out, if we look at low doses of spaceflight radiation in collaboration with people like Greg Nelson, Marcelo Vasquez, Dyla Gridley, Mike Picot, we really identified that low doses of radiation can cause bone loss. So it became clear at the time two things. One, we really need to actually incorporate radiation into the response, which was exciting at the time because it was a new potential hazard. And then two, it pointed to the fact that maybe fractures that occur clinically were due to the radiation effects as an early response. And so what started it all for me wasn't really the radiation. It was the bone loss because of microgravity, which is still a huge component of our research, right? I do plenty of projects that don't involve radiation, right? I got to keep myself grounded in that field as well.
So the Osborne Award celebrates advance in understanding normal tissue response. Looking back, what discovery or turning point in your career has surprised you the most?
There have been probably 3 or 4 turning points in my career in which we looked at each other and we thought, oh, wow, this really means something. Now, the biggest one occurred was our first discovery, and that was one in which we were trying to identify what could cause long-term late bone loss that occurred as a result of radiation. That's what it was. It was late long-term bone loss, and we were thinking about T cells, inflammatory responses, related immune system responses, and how downstream this whole field of osteoimmunology could tie into this late bone loss that occur after radiation, months after treatment. And so that's what we were focused on. So we were looking at studies in which the animals were irradiated, and we were looking at the bones months after treatment. Well, in collaboration with Dyla Gridley and Greg Nelson, we had some bones that from animals that had been irradiated just maybe 2 weeks earlier. And we just decided, let's just take a look at the bones. And we were told by multiple people, don't waste your time. Because if you do that, you're not going to see anything. There's no way that bone loss could occur that rapidly. But what we found was that there was substantial bone loss that occurred after only 2 weeks at a rate which really is unprecedented, even amongst osteoporosis studies in rodents. And the architecture, so the integrity of the bone was completely crushed. And because it happened so early, it was obvious to us at that moment that radiation had to turn on the cells that break down the bone, the osteoclast, which we immediately recognized as bone bioengineers you can prevent, because that's what osteoporosis medications like bisphosphonates do. So we took that to our PI. It was myself and Shane Lloyd, who's now a radiation oncologist out in California, presented that information to Ted Bateman, who was our PI in bioengineering, and he looked at us and said, "Do you see the implications?" And it was obvious we did. So to us, that has really fundamentally changed the path of my career, right? It gave us something to focus on. It gave me something to focus on. And that focus has really, really driven my career. It's helped drive the research of my trainees. It's helped drive the research of a lot of the physicians in the clinic and the residents. So it's been really a great experience for something that we found sort of by accident. You know, in radiation research, we know until we don't know it, right?
Yeah. What advice would you give to early career scientists like me or other SIT to thrive in academia and more specifically in radiation research?
Here's my advice in radiation research for trainees in radiation research. Okay. One, I would say that you have to step out of yourself and you have to create a network of individuals with whom you collaborate. I think a lot of times people go to meetings and they're excited about the science and they want to present the science, but they don't necessarily focus on making the connections, right? And a lot of people have great mentors which will help them make those connections, and that's fantastic. Other people do it on their own. For those of you who have to do it on your own, or if you're with a group, understand that in our society, making those connections, those personal interactions, those relationships are really what drives success. Because one, they can vouch for you. I've had plenty of individuals, write recommendations for those in my career, and I've done it to others as well. When you show interest in somebody else's work, they're going to inherently be interested in your work, and they're going to want to promote you and work with you, which will help in this sort of environment with us getting jobs. It'll help promote the science, both your science and the science of your collaborator, because it provides you with other opportunities to say, go to a proton facility to do irradiations, go up to Brookhaven, go to a clinic like mine and irradiate after hours using a megavoltage X-ray unit or a small animal irradiator orthovoltage unit, right? So if that means stepping out of yourself and realizing you can talk to these people to make those connections, you have to do it, right? If you're shy, I understand that. But if you just show an interest, just say, "Hi, I'm really interested in your work. I just wanted to introduce myself." When you show an interest in other individuals, they'll appreciate that. They'll show an interest in you. So that's one, make your connection. Two, you need to find a mentor who wants you to succeed without themselves gaining something from your success. You want to find a mentor out there in radiation research that just wants you to succeed for the sake of your success. It's great to have mentors like your PI, other individuals in an institution, other individuals who may want to hire you, but all of those individuals, they do benefit from your success. What you really need to do is find somebody, it could be outside your institution, inside your institution, that will be very, very honest with you about your career path in science without themselves gaining benefit from it, other than just seeing you succeed. Because if you do that, they're going to give you advice that you otherwise might not get. And you have to rely on people's advice. Because to be honest with you, we're not really trained as postdocs or as graduate students for a job as a PI. So having mentors that are honest with you about what it takes to succeed are really what you need to do in order to move to that next step. And number three, when you're a postdoc, there are, as I mentioned, we're not really trained to be a PI. We're trained to do science. And then you become a PI and it's more managing science and managing a small business. I would suggest that as you move along, have these communications early with your mentors about seeing what happens behind the scenes, understanding really what it takes to succeed, as a PI in the radiation sciences. Maybe get them to give you the opportunities you need to do the work, the scholastic kind of work that we do on a daily basis, whether it's giving talks, whether it's reviewing for journals, whether it's advocating for us for even maybe going to review panels if that's even possible, right? Maybe involving us in those sort of meetings that you don't know that we're doing when we're not in our office, right? So that you understand what the role of a PI actually is, so that you can make a decision. Is this the path I want to go down, or perhaps another path? And by the way, I would also argue that one of those mentors certainly could be an individual who has experience in both not only academics, but government, as well as industry. So those are the kinds of things that I would advise. And I would also finally say, be passionate about what you're doing, love what you're doing, and learn how to describe what you're doing in terms of letting other people know why it's valuable. It's valuable to them, it's valuable to society. Learn how to sell your science in a very clear manner.
That was a very good point. I'm sure it will be very helpful. I find it helpful myself. So yeah, thank you so much for all this advice. And I feel that the Radiation Research Society is a very good place for connection, finding mentor. They really are supportive in creating this environment for that. So yeah, we have to take the opportunity.
Absolutely.
If you had a chance to sit down with Marie Curie over a coffee, what will you most want to ask her or tell her about radiation research today?
All right. Well, so first of all, what I would like to tell her is that she's one of my heroes. And that part of the reason that I'm so excited about the work that I do comes from, the sort of successes and the pioneering work that she performed over the course of her career, right? I mean, we all can agree it's absolutely amazing. And I love letting people know that, look, you are clearly an individual who has influenced me throughout my career, and thank you for that. I think with her, what intrigues me is the fact that, we knew so little, obviously, about radiation at that point in time. And I think we're all very well aware the consequences of her scientific career had on her health and ultimately on her life. And so I would just want her to reflect with me on her career, right? Both her scientific advances with her daughter family, what she feels were the biggest sort of successes that really advanced. Nowadays I can explain to her where we're at and let her ponder about how her findings have really advanced where we are with radiation sciences and healthcare delivery. But I'd also like to know, what regrets does she have? Does she have any regrets, right? Because clearly there were consequences of her work for herself personally. I would just love to have maybe a 2 or 3 hour conversation with her about, her thoughts on how things are right now, reflect on her contributions. We could have that discussion, and then just know, what are the things that made her happy, knowing where things are, and then in knowing, as a person, are there regrets, right? So, I think it would be a fantastic conversation to have with one of my heroes.
And if your research journey were a space mission, what will be its name, and what will be the ultimate destination?
I guess we've had a couple, right? But those were, sort of NASA missions. And there was one NASA in collaboration with the Japanese Space Agency mission, in which we were in low Earth orbit, and we were looking to see, how artificial gravity or just spaceflight in general can affect musculoskeletal tissues, the same kind of stuff. If I could have my own spaceflight mission, right, where I could go up, I gotta admit, to me, I really want to know what is going to be the countermeasure that we're going to have to protect bone and muscle health while we're in space, right? And I would love to go outside of low Earth orbit, and I would love to be in the craft that we're going to take to Mars. Because right now, the craft we're going to take to Mars isn't going to have the sort of same exercise modalities that we currently have on ISS to protect against musculoskeletal health. So I would like to be the person that, after the physical therapist and the exercise physiologist and the nutritionist figure out what might be the best strategy, whether it's a bisphosphonate to prevent bone loss together with an antioxidant or something else, maybe a myostatin inhibitor to prevent muscle loss, together with some sort of exercise regimen, probably some sort of deadlift, which has been shown to really prevent muscle loss and bone loss, together with, and promote recovery. I would like to be the guinea pig outside of low Earth orbit to try out what is the best exercise regimen to see if we can protect against musculoskeletal degradation during spaceflight. And what would it be called? Atlas 1 or something like that? I don't know. I mean, certainly not in reference to me, but I mean, I don't know. Sorry.
Yeah, that's very brave. Myself, I wouldn't go in the space, even though I love space exploration and I hope we will go to Mars, but I won't go myself. So that's very brave. Thank you so much for your time. I'm sure all the community will really appreciate all your answers, especially the scholar in training and young career scientists.
Look, I appreciate meeting with you. I will say this, being involved in the SITs and the ECIs throughout my career, whether when I was one and now in training, that I think is one of the most important thing, if not the most important thing that we can do as we get older in our career, right? Mm-hmm. So get a mentor, be a mentor, and help everyone advance. We need it in our field, right? So I want to thank you for the opportunity to talk to everybody, and look forward to see everybody next year at the Radiation Research Society. And don't forget about the meeting.
Yeah, definitely see you there.